we set ourselves apart as a metropolitan university that emphasizes innovation, impact, and improvement.
If you can't utilize it at the bedside or in a facility, then it doesn't do us much good.
We're specifically coming at it from a very practical nuts and bolts perspective.
That means that they have to be able to ask the right questions, they have to be able to search and find the best available knowledge, they have to be able to appraise that and critically think.
So what we're trying to do is embed these skills into the nurses so that when they go out there, they're ready to practice.
Our doctoral and nursing practice program was specifically and uniquely built to fill a gap of now we know what to do, but how are we going to get it done? In the DNP program, we really focus on the implementation science.
Translational science is putting together all the pieces about the research that we know is out there, what is the best evidence, and then putting that evidence into practice.
So evidence-based practice gives us a really good idea of what works in the real world versus what doesn't.
Students in the DNP program address real problems in hospitals and clinics, synthesize the available work that is out there from a research perspective, then establish a list of best practices and inform the hospital administrators on how to implement these best practices.
So at the graduate level, they're looking at transfer science and implementation science in the bigger picture. They're looking at how to lead these quality improvement projects and how to actually use the strategies that they've learned.
My DNP project is on first-year nurse turnover. We need to figure out the causes of that, the causes of them leaving a hospital or a facility or the profession in general. So the work that I'm doing in my project is looking at the details that go into the onboarding and orientation of new nurses into a hospital to identify the issues that cause nurses to feel unsatisfied or have increased workload or work stress.
My ultimate goal is to work in the geriatric population. I noticed when I was working in long-term care that there was a gap between the diet that the doctor specifically ordered for a patient as opposed to what they were receiving. In order to bridge that gap, my DMP project is to implement specific diets identified on the menu for the patients at the facilities. I wanted to treat my patients the way that I want my grandparents treated.
It takes a long time for research to be developed and then also be put into the literature, and takes even a longer time for that research to be utilized at the bedside. That's where translational science will help us to implement these strategies and evidence at a faster pace.
Students in our program also are able to avail themselves of our Indiana Center for Evidence-Based Practice, which is a collaborative effort with the Joanna Briggs Institute, a worldwide initiative to bring several sites and centers together to promote evidence-based practice. We have collaboratives with each of the students' organizations where they work, and this allows the student then to be able to create a project that is very local to their specific needs and to the clients that they serve.
So we take our real-world experience and our education, and then we use that to build a forceful case for the kind of policy that we think is going to help our patients in the end. When, the rubber hits the road, nurses are almost always the ones who are out there making sure that policy is implemented.
The focus of all our curricula are to graduate our students who are able to go into the workforce, meet the needs of our clinical partners in order to use the best available knowledge to advance the best possible patient outcomes.